Muy buenos días a todos y a todas. Soy Silvana Luciani.
Good morning, everyone. I'm Silvana Luciani, Chief of Non-Transmittable Disease at PAHO, Washington, D.C. It's a great pleasure to be here with you and give you the welcome to the PAHO seminar on children's cancer. As you can tell, we have simultaneous translation and also the video in 4 languages: English, Spanish, Portuguese, and French. So we invite you to choose the language of your choice. Right on the bottom, you'll see a globe, and you can choose the language of your choice. And this will be in Spanish and English mainly.
And enthusiasm that today we're launching this new publication, a very special edition of the Pan American Journal for Public Health, a special edition on cáncer infantil. And the publication coincides with the 5th year of the Global Initiative for Childhood Cancer, an initiative that we from PAHO, together with all of our partners, are implementing in the Americas region under the name of Cure All Americas. And so the publication documents the great work that's been done over the past 5 years in this region, as well as globally. And it's a real pleasure that we have in this webinar all of the leaders, the global leaders, the regional leaders in childhood cancer, who are also the principal authors of the publications that have been published in the Pan American Journal. There are 15 articles currently published, many more to come as we continue. So let's hear about this great new publication. And to start the webinar, I'll invite Dr. Anselm Hennis, the Department Director for Non-Communicable Diseases and Mental Health at the Pan American Health Organization. Dr. Hennis.
Thank you so much, Silvana. So good day, and I wish to extend a warm welcome to the honorable representatives of Ministries of Health, National Pediatric Cancer Plan Committee members, focal points of the PAHO country offices, foundations, hospitals, ladies and gentlemen. I'm the director of the Department of Non-Communicable Disease and Mental Health, and it is with great pleasure that I bring you greetings from PAHO and the Cure All Americas technical team. Thank you for joining us in this webinar to launch the special supplement on childhood cancer in the Pan American Health Organization Journal of Public Health. This special supplement acknowledges the shared accomplishments of the joint work between the Pan American Health Organization, St. Jude Children's Research Hospital, and the member states in our collective effort to achieve optimal outcomes for those suffering from childhood cancer, while acknowledging the long journey ahead to fully achieve the PAHO-WHO Cure All framework in the Americas. Childhood cancer is eminently curable in a majority of children when essential diagnostic, therapeutic, and supportive care services are both available and accessible. However, profound inequalities exist in access to quality care, resulting in survival rates of less than 30% for children living in low and middle-income countries, compared to survival rates of over 80% in high-income countries. The Cure All initiative was formed with the vision to reduce this gap. In 2018, the World Health Organization, working collaboratively with St. Jude Children's Research Hospital, launched the Global Initiative for Childhood Cancer, or GICC, to provide leadership and technical assistance to governments to support the development and sustainability of high-quality childhood cancer programs. PAHO is pleased to be implementing the GICC in the Americas. This collaboration has achieved significant progress in implementing the Cure-All Technical Package to address childhood cancer in 18 focus countries and regional networks in Latin America and the Caribbean. Today is not just about discussing statistics, but a reminder that member states must scale up progress towards achieving best practices in childhood cancer control, focusing on health equity. We believe that all children must have access to optimal services and care, and therefore on International Childhood Cancer Day, our call is to renew the commitment to enhance the lives of those whom we serve. We are excited to commemorate the third year of this campaign under the theme of Better Survival is Achievable, #Through Their Hands, which pays tribute to the positive impact of families and caregivers on the lives of children and adolescents with cancer. Welcome to this webinar.
Excellent. Thank you very much, Dr. Hennis, for those warm, welcoming remarks and for all the tremendous leadership and support that you've given us in the team of Childhood Cancer Initiative over the many years. And also, we've had tremendous support from the PAHO leadership. Our new director, Dr. Jarvis Barbosa, has written an editorial for this new special supplement on childhood cancer, and I invite everybody to read that. So thank you again, Dr. Hennis. Bueno, todo el trabajo documentado en este número especial de la revista no fuera posible sin el increíble apoyo.
All of this was impossible without the total support of St. Jude's Children's Hospital that is always there with us, collaborating in Latin America for children with cancer. It's an honor to introduce Dr. Carlos Rodriguez Galindo, very well known to all of us, Executive Vice President Chair, please. And also, ele também é.
Rodriguez Galindo, over to you.
Thank you so much, Silvana, and thank you so much, Dr. Hennis, for your kind words and for inviting us to be part of this wonderful day today as we all come together to celebrate and reflect on all the advances and all the challenges that we still have ahead. So I may just switch to Spanish now. Anyway, muchas gracias, Silvana. Muchas gracias, Dr. Hennis, por...
Thank you very much, Silvana. Thank you, Dr. Hennis, for your kind words and for the invitation. I'd like to thank you all from PAHO for the amazing work you have done and to be able to reach this point after the 5th anniversary of this initiative and the publication of this journal that will definitely change the way children's cancer is understood in the Americas and how we face the challenges to come. Thank you very much, all the representatives of PAHO that made this possible, and all the national offices in Washington, D.C., inside your homes, and all the professionals here. Thank you, all the government officers that are present here today and have helped throughout the years so that this could have been possible. Directors of different hospitals, physicians, nutritionists, all those nurses that are involved in cancer care. So all the associations, those of the different countries and that work towards this. Thank you very much, everyone, for being here with us, and welcome, everyone. And on behalf of St. Jude, I'd like to thank you. And that's what we have at St. Jude, all our friends from St. Jude today, when we gather to celebrate all our achievements and to see what is still the path to be paved. It was an honor to have been invited to work with the PAHO teams in any place in Americas with all the different government officers as the Children's Collaborative Center for WHO and PAHO. I have tried to help in the implementation of the global initiative in all countries and in all the programs in different hospitals, working side by side with you from PAHO, the different ministries, and all the professionals. For me, it is a great joy to be here sharing and having this next few hours with all of you. We have now the opportunity to see much more for the next hours, and we will pay attention to all the data to be shared. Again, I'd like to thank Silvana and the PAHO team for holding this special event on children's cancer. As we said, it will be a before and after. And we bring children's cancer to face us so that it can pave the way to us. We have a very interesting meeting in the next sessions, and we will carry on with the conversation. Thank you very much. Thank you, Dr. Galindo, and you are definitely a champion and a major partner to all of us, and to improve care with children with cancer. And Dr. Rodriguez Galindo also wrote an editorial to this specific journal edition. And the Pan American Journal on Public Health is something we're proud of. It is the main periodical, scientific and technical for PAHO, and it is now giving scientific articles, and it has been for over 100 years. And here we have the chief editor, Damian Vasquez, so he can bring us a main review of all we have in this publication. Good morning, everyone. It's great to be here. Thank you, Silvana. I am very grateful for being here. In these few minutes, I'd like to share 4 points related to this, but they definitely have some difference in terms of the topic to be addressed. As it has been mentioned, someone who has cancer, usually this person becomes a patient, and they know that they must do something about it and that they have something that they need to be concerned with. I apologize. I'm showing the slide, but it's not turning. Let me stop sharing and trying to share again. Let's see.
Muchas gracias. Decía que cuando se le dice a alguien que tiene cáncer, la
Thank you.
persona
Okay, when you tell someone they have cancer, they know that there's something that they will be busy with and be concerned with. When we're talking about children's cancer, we're talking about tasks to be addressed and approached by the whole family. What to say about a child at an early age that don't even know what's going on, and also having a point that as physicians we're trained to care but also to support and be efficient with the whole program. And the good news is that children's cancer is improving survival rates and the diagnosis cure rate over time. But if we check and take a bird's view on public health, we see that there are gaps, and the survival rates are much lower when it comes to low-income countries compared to the high-income countries. And here, one last point, which is of a scientific editor. Definitely, that's the importance of this special edition. When we have a research study, it can remain in a specific place where maybe people don't really know the results, but when it is made public, we have a potential action to be taken in healthcare. And for that reason, it will provoke a virtuous circle, and the academia can be based on this for new research. Health professionals can improve their medical practices. Decision makers can draw new public health policies, and the general public can be more aware of a specific problem. So I must then invite you to go into our webpage, and the journal here shows that we have been for 6 years online. You'll see this with a bit of a description and the links with 15 articles of different topics. That's what we have up to now. We will add other ones as we have them ready to be able to publish. And something that is invisible, but sometimes it's important to mention, that it's a teamwork. And I calculated how many people on average take part in a text to be published. And if we have here 24 and we multiply by 15, we're talking about over 300 people. I mean, the ones that donate, collaborators, other institutions as St. Jude's, that has also contributed so that we could have this journal edition. I'd like to thank you all who are here in this webinar, and I'd like to pass the floor to the host. Thank you, Damien, and for your whole effort that definitely mirrors this amazing publication with 15 articles and another 4 that are to be published and being revised. I'd like to invite everyone to visit the website and to download the special edition. And all that was shown in the articles in the journal wouldn't be possible if it weren't for the main extensive collaboration of all professionals working hard in the last 5 years. And in the last year, to be able to have the articles ready. And I'd like to thank everyone for that. And I'd like to invite Dr. Mauricio Maza, Advisor Cancer Prevention and Control at PAHO. So Mauricio could give his words. Thank you, Silvana. Thank you for guiding us throughout this day with celebrations and to disseminate all the information and the experiences that we've had. It is an honor to take part in such a significant event, which is the special rollout of this journal edition. So it is the result of a collaborative work with many actors, all committed with the fight against the children's cancer in Latin America and in the Caribbean.
I would like to highlight the joint efforts of the member states and the civil society and all the health organizations, and also followed by the WHO, through the regional office, which is our organization, the PAHO St. Jude Children's Hospital, within the World Initiative Against Childhood Cancer, which was launched in 2018. Celebrating these years, we have celebrated all the advances we made, but we still have a long way ahead to ensure the supplementation of this landmark in the World Health Organization. Today, we will share with all of you the different articles which we have in this edition. There are 17 articles, as Silvana mentioned, and we hope that we will have even more articles. But first of all, we would like to thank all the collaborators for this work. I don't want to forget anybody, but you have to understand that these initiatives, to become a reality, we need the help of many. So we have the United Nations, we have the missions where we assess the cancer component amongst children, and the Cancer Channel International. We have non-profitable organizations, and we also have collaborations which help us with material and all integration material, such as Komiska, Kafka, PAHO, and the Society of Pediatric Oncology, and other organizations and Pediatrics Association, which support the countries, and also the Children's Research Hospital, which helps the WHO with childhood cancer. And they have supported these countries for many years. So I always want to thank all these teams from our region that work very hard in the different departments in the different Caribbean regions and in all these countries, and also the cancer departments of the WHO, so that we have the same vision throughout the world. We have these teams which are organized by the Ministry of Health, and also the organization of civil society, who have always supported us in such an amazing work. So I would like to thank the health providers that offer the service directly to the patient, and the treatment to all children. And that way we help the children, these patients and their families. So in fact, this is what I said before. It's a very long list, and I hope I haven't forgotten anybody, but they're all the institutions that really support us. This is a short testimonial of what we can do when we work together, focusing on the same purpose, which is to help the lives of the children and their families in the region. We are transforming childhood cancer treatment in the Caribbean and Latin America, and we are working towards a greater equality in health. And I always say this to all the people who work with us, because we wish everybody worked the way we do, that the associations amongst civil organizations, and we need to have this support among agencies so that we really have an impact on everyone who is suffering with this terrible disease in our region and in the whole world. Thank you all. I really just wanted to thank all the people who make this work possible. Excellent, Mauricio. Thank you very much. So we are here talking about amazing work. There are over 200 people involved in this work and the preparation of all the articles of this supplement of the journal. So I also would like to thank you all. So we are really
a person who should feel even more proud than any of all of us, and that is the mother of Cure All, the person who helped create this global initiative for Cure All, of which we adopted it and developed it for our Americas region, for Cure All Americas. So we have the fortune today to have with us Dr. Catherine Lamb. She's the director for Asia Pacific region of St. Jude Global, but also the director for Health Systems Unit and co-director of the WHO Collaborating Center for Childhood Cancer at St. Jude's Children's Research Hospital. And she's going to talk to us about the article she wrote and about the work on strengthening health systems through a regional collaborative effort. Dr. Lamb, over to you.
Muchísimas gracias, Silvana, Mauricio, y todo el equipo. What a privilege and pleasure it is to be here with you all and to celebrate this 5-year anniversary of the Global Initiative for Childhood Cancer, as well as the 5-year anniversary of St. Jude Global as the first and only WHO Collaborating Center for Childhood Cancer since March 2018. And so this was one of the papers we've had the privilege to work on together on partnering to implement the Global Initiative for Childhood Cancer in the Americas and how we can prioritize system strengthening. Next slide. So you can see here, this is really the hearts and hands of many across St. Jude Global and PAHO. And on the next slide, this group knows very well that we are interested and invested in this because cancer, unfortunately, remains a leading cause of death and morbidity. And at current health systems capacity, 10,000 children or more will die from this disease, with countless others suffering. And so St. Jude is very committed as the WHO PAHO Collaborating Center for Childhood Cancer to address this in practical ways, as well as deriving the research and the tools to look at childhood cancer in the broader perspective of system strengthening. Next. We see this Health Systems Plus framework that we've been developing over the past 7 years together, building on service delivery and workforce and information systems and medical products and technologies, financing and governance, and very much the importance of family support and community engagements, centered all on individual children with cancer, as well as populations of children with cancer, and being able to look at those needs holistically. One of those tools in which we have applied this Health Systems Plus framework is called C5. There are 5 C's in the name: country collaboration for childhood cancer control. And this is meant to help us think through these different dimensions and their interactions as we work together to strengthen systems and to implement the Global Initiative for Childhood Cancer. On the next slide, we've outlined some of these individual modules. On the next piece, you can start to see the first 2 modules, for instance, C2 and C3, where next we look at mapping institutions, organizations, and roles, and the systems, weaknesses, opportunities, and threats, clarifying altogether the context and the actors and the factors that extend beyond the clinic. And then next, looking at the C4 and C5 modules. And next, we can see how altogether we might prioritize activities for action, considering time and local values, political will, and resources. Next, really, this article is just the beginning of us summarizing some of the efforts, thanks to the amazing regional teams with PAHO, being able to look at how system strengthening efforts can extend across 10 different settings and be applied to inform country and regional action plans. So it's very much about national cancer control planning, collaborative work, and identifying those implementation success factors. It's really about engaging not only the wonderful traditional actors in the childhood cancer space, but all actors in finance and governance, those who are working in registries and information systems more broadly, and looking at broader child health and broader non-communicable diseases and infectious diseases, and linking all those efforts together, having a flexible mindset and very much co-designing with all our core stakeholders. All of this has led us to see how we can improve policies collaboratively, capacity, and quality of care, because it's not only a piece of paper on a shelf when we're looking at national cancer control planning, but very much about quality in all that we do, and being able to see that translated into actionable improvements for children and for families, and not as siloed projects, but very much as part of broader systems efforts. So we very much look forward on the next slide to see how all of this continues to grow across all of Cure-All Americas, thanks to all the wonderful partners on the call today and beyond. And we really appreciate learning from all of you. And we hope you will continue to share more of your success stories, more of your lessons learned, so that we all together can see, as we head towards 2030 and the goal to save 1 million more children with cancer, how we can do that even more effectively with all hands in. Thank you.
Excellent. Thank you so much, Dr. Lamb. And this perspective of strengthening health systems is so critical to improve outcomes for children with cancer. So I applaud you for the thinking and the conceptualizing around the system strengthening, but more importantly, you and all the others who have been involved in implementing the C5. It's an outstanding tool to use for system strengthening. So please, everybody read the article. It's excellent. Thanks. And congratulations again, Dr. Lamb. And so we'll move now to a global perspective and looking at the progress and challenges of global childhood cancer care. And it is our privilege to have Dr. Roberta Ortiz, the leader of the WHO Global Initiative for Childhood Cancer, today to present the article that she has written on this and to talk about the advances. And we're so proud that she's from our region. Over to you, Dr. Ortiz.
Thank you so much, Silvana. Y voy a hablar en español, ya que tengo la oportunidad de hacerlo. Y buenos días, buenas
Good
tardes.
morning to all the participants. It's a great pleasure and honor to be here with you all. And I would like to thank the organizers and my colleagues of the regional office for this opportunity of celebrating together with you all everything that we have achieved in recent years. I'm going to share with you the experience of other important teams, and other regions are also working and advancing a lot so that childhood cancer be a priority amongst the health systems, regardless of where they were born or where they received their diagnosis, but they should have quality treatment. So here, as has been mentioned before by Dr. Jenny, Maris, and Carlos, this gap that we see in the survival rate of childhood cancer is due to the enormous inequalities. And childhood cancer is a public health priority because of the 400,000 children that were diagnosed with cancer a year. 80% of these children live in low-income countries, and not all have access to precise diagnosis and treatment. So to face this enormous inequality because of where this child was born led to the development of this global initiative 5 years ago, together with the support of WHO and also our partners at the St. Jude Hospital. And that's why we're here today celebrating what we have achieved so that the countries can give priority to childhood cancer in their public policies and offering quality services to them. And that way, we can increase the survival rate of the children in 60% worldwide. Next slide, please. So this initiative is the direct result of Resolution 7012, which is a cancer control in a focus of an integrated manner. So that's why we were able to have more support, especially paragraph 1, where the WHO can adopt joint tools and justify this and have integrated programs for prevention and control of cancer, but within the children and adolescents management programs. So we use other organizations. So we thank St. Jude very much to be working with us, and also setting up these new laws, which is the marker which was very important for us to increase this overall coverage. And we can see this by the development of more new laws which have been established within the 6 regions. So you have a very important example which has been summarized in many articles, which are part of this special supplement of our journal. And you have some in Central America and I am proud of being part of this region, but also other countries such as places like Africa and Southeast Asia and in the Pacific region. So these issues helped everyone to have better quality care, and also to help the parents of these children who were diagnosed. And they also have access to free treatment for the children. So in this supplement, we were able to show how they increased childhood cancer in the national cancer plans of the different regions. Before, we had cancer plans were only present in 7 countries, but since 2007, they've included it in 13 countries. And as Mauricio mentioned, there is a collaboration of our partners and other agencies of the United Nations. And we are also working and advancing in Africa. And 4 countries have included childhood cancer amongst their national health plans. And they are considered priority, and financing these plans. And in November, we will have our first mission going to Ethiopia, because they have included childhood cancer as their health policy. Next slide. So improving cancer control is part of what all the health systems are doing, and that way we can encompass the health system. So childhood cancer was given priority at regional and global in terms of health policies. I'm going to show you an example here. This childhood cancer was integrated in the context of diseases which are part of Appendix 3 of the Global Non-Communicative Disease Action Plan for 2013 to 2030. And that way, we have shown that with small strategic investments, we can improve the health of children with cancer. And that way, we can also show that each dollar invested, we receive 3 as a return on investment. And this allowed us to continue our services, which are rendered to the children with cancer through the health systems, which sometimes are affected because of natural disasters or wars, which is the example of Ukraine and Sri Lanka, and now with all the efforts that they are doing in the occupied territories of Palestine and the Gaza Strip. So all this was obtained through activities which were supported worldwide, which ensured that services will continue to operate, offering care to these children, thanks to the solidarity of the civil society and researchers and all of them who are supporting. And to finish my presentation, I would like to summarize that over 70 countries all over the world are implementing this initiative for childhood cancer, which is Cure All. And thank God to the global partners and St. Jude's, the countries are receiving technical and financial support.
And that way they're evaluating their capacity to act and bringing possibilities of investment, and that we're drafting standards and patterns to offer quality care for all children with cancer. So this gap that is conditioned to the location of where a child is born can actually be taken away. And to be able to have the surveillance of these programs where more children and teenagers can have quality care. Here we have a quick examples to show you of best practices in the Southeast Asian region in terms of a shared model of care, which was a strategy that was developed to reduce the abandonment and be able to make it easier the access closer to their homes. And this is an example that was very efficient in Nepal and now is extending to other two countries in the Southeast Asian region. And we know that in Americas also there are many efforts to standardize children's care for the health services. And there are many efforts that are taken and supported thanks to the collaboration and technical assistance of St. Jude with the area platform in African countries and also the East Mediterranean. Thank you again for allowing me to take part in this great celebration. And it's one I'm very proud of to give support to the different teams around the world. Thank you very much. Thank you, Dr. Ortiz from the World Health Organization and leading the Global Initiative for Childhood Cancer. And the World Health Organization has an important role to change national policies to favor health care and improve quality to children with cancer in 70 countries in the world, implementing Cure All. I believe it is a very important advance. Thank you very much for all the support we get in our region from World Health Organization, right from Geneva. Thank you, Dr. Ortiz. Now we shall pass to the next topic.
The burden of the disease, but also to monitor the impact of our interventions. So we work very closely with the International Agency for Research on Cancer that does extensive cancer surveillance in our region, but globally as well. And so to present on the incidence of childhood cancer in Latin America and the Caribbean and review some of the coverage patterns and trends, we have Dr. Eva Steliarova-Fouché, who's the scientist from IARC, who will present the paper that she's written on incidence. Dr. Steliarova-Fouché, over to you.
Thank you very much. I hope you see a proper slide screen.
Yes. Yes.
Okay, very good. So thank you very much. It's a really privilege to speak in this forum and to present the results of our work on behalf of many co-authors and collaborators. So I will introduce them throughout my talk. I have added IARC logo on my slide to show that we are also part of the WHO organization. And since many years, we are working with cancer registries around the world to collect data also on childhood cancer. So as you know, this work is set in the context of Global Initiative for Childhood Cancer, which highlights the important role of cancer registries in providing data that are needed to control cancer and specifically childhood cancer. And this was also highlighted in the recent publication by the Lancet Oncology, the special commission paper on childhood cancer. So, but we started this work some years, many years earlier, in the framework of International Incidence of Childhood Cancer project with the editors that are on the photographs, who spend a lot of time trying to make sure that the data that we have collected are comparable, and that the data that we present are meaningful for the different parts of the world. So this is the third in the volumes of International Incidence of Childhood Cancer. And based on this database, we selected information on Latin American countries that were that contributed to this third volume, and describe the patterns of cancer incidence in children in this region, which is a region very well inhabited by 600 million inhabitants, and has many specific features, many specific backgrounds that are different in different countries. We can see that the coverage by cancer registration is relatively inadequate because it's less than 20% for a population younger than 15 years, and it's less than 10% for population between 15 and 19 years. So because of the large national pediatric cancer registries that cover the whole country of Argentina and Chile, the coverage is slightly higher for childhood population up to 15 years of age. So this is the region of many contrasts and many a large potential for development of cancer registration. So here we can see the overall contribution to this study, which was based on almost 37,000 cases that came from 276 million person years over 2 decades. And because registries did not cover the same period, we have to select registries that contributed to different types of analysis. So for the decade of 2000 and 2010, we used different data sets for pediatric population and for the population that covered children up to age of 20 years. And then we also use data for 20 years to examine the incidence trends. So as you can see, the overall incidence rates were 130 approximately in children and 150 in adolescents. And we have seen a small increase, about 1% per year in the region. Here we can see the distribution of different tumor types, the most common leukemias, then leukemias increasing over age. These are CNS tumors and neuroblastoma, which are an retinoblastoma that are very common in young age, but then they disappear across the age groups. We have also compared the data for Latin America with rates that were observed either in North America or in the world. And here you can see the comparison. Latin America in red. We can see that there were some cancer types that were more common in Latin America than elsewhere. And these were lymphomas and other unspecified tumors. And we have also seen that several tumor groups were less common in Latin America, such as CNS tumors, much less common, neuroblastoma, renal tumors, hepatic, and so on. These are all those that were significantly different. And we can see also that leukemias are intermediate between those that were between the rates observed in Northern America and worldwide. So what we think the higher rate of lymphoma may be connected to the specific infectious agents, such as Epstein-Barr virus or Kaposi herpes virus or other viruses that are endemic in the region. And the lower rates that were observed might be due to difficulties in making diagnosis or with registration, but there might be also different risk factors. So all this will need to be examined in future studies. So as mentioned, there was a change in cancer incidence, which was increasing over time in Latin America. This is shown with the red curve. It was increasing on slightly different scale in South America than in Central America and the Caribbean, but overall there was an increase in across the continent. And here we can see the scope of the increase, so overall 1% per year. And it was seen in Central America and South America, the two subregions for both sexes. And for the different tumor types, here we show only those increases that were significant. As you can see, there were there was increase in CNS tumors, retinoblastoma, hepatic, bone tumors, germ cell tumors, carcinomas, and there were differences in between the subregions for other and unspecified. These are those tumors that did not have a precise diagnosis, which was very much increasing in Central America and the Caribbean and decreasing in South America. So in conclusion, these are this is very fast run through a lot of results and a lot of tables. We can conclude that the coverage of Latin America by population-based cancer registries is really inadequate, but we also note and highlight the existence of two national childhood cancer registries. The incidence rates are relatively comparable with others observed in other parts of the world, and there is small increase over time, which will probably continue until the rates reach the similar scale as, for example, in North America. And this will go hand in hand with socioeconomic development of the region. So to improve cancer registration, it is very good to use the GICC momentum of this initiative, as was shown, that the countries are really taking on and joining the initiative. And I would like to say also that we are helping countries within the collaboration with St. Jude, which we call Child GICR, to develop or improve cancer registration in children. So this is just the photos of my co-authors on the paper, as well as all those that are represented on the map in the background. So thank you very much for your attention. That's all. Thank you.
Excellent. Thank you very much, Dr. Stolierova-Fouché. This is an incredible analysis. And for all the epidemiologists that are connected, I'm sure you would love to see more of this analysis, but we invite you to please read the paper. It's outstanding. And I can almost hear the comments from the audience of why did the data stop at 2012, more than 10 years ago? And I think that really echoes the point that you're making, that we need to help countries invest more in cancer registration, invest more in cancer registries as part of their national cancer programs and plans, as part of childhood cancer initiatives. So I echo your call to invest more in cancer registration to have this important data available. So thank you again for the great work.
Thank you.
So we continue with the program and want to highlight the great work that we have been doing here in the Cure All Americas initiative at PAHO, working closely hand in hand with our partners at St. Jude's, with our colleagues in ministries of health and the civil society organizations. And so we're very pleased and proud to have our own Dr. Liliana Vasquez, who coordinates Cure All Americas at PAHO, to present on the article on the current situation of childhood cancer in Latin America and the Caribbean and progress with the Cure All Americas initiative. And she will be doing the presentation jointly with our dear colleague, Patricia Logueta, who's the project coordinator for Central and South America regional program at St. Jude's Global Pediatric Medicine Department. So over to you, Liliana and Patricia.
Muchas gracias, Silvana, por la presentación, y gracias a todos, realmente todos los que están presentes el día de hoy en este webinar regional.
Thank you very much for being here with us and being in this webinar. It is a great pleasure to be here and see what we have achieved together during the last 5 years. And I would say that in the last 3 years, mainly with a greater visibility and trying to take childhood cancer as a public health condition in terms of its magnitude, in terms of all the messages to be sent to all the ministries, all the decision makers, and policies, civil society, and to really make the voice echo. That's what we want to show you here together with Patricia. First of all, a summary of what is a special report of this specific childhood cancer journal publication showing the progress in the last 5 years of what we have here. We have the QR code. Once you do have time, you can check. It talks about the equity concept and not have anyone left behind, to work with all countries, all government and agencies to have indicators that can show impact. We know that the global initiative for childhood cancer is to get to 50% by 2030. But what we want to reach is even more than that, to be articulated, working to have results so that at least 80% of the countries in the Americas region can count on plans, programs, health policies that can include children's cancer, so that it can reach at least 80% of countries that have implemented the programs, the projects, interventions of Cure All, and strengthening the health system, as it was mentioned, to work so that it can be sustainable activities over time, and to be able to have regional efforts that can address these problems that are very common to all countries, as the time of diagnosis, abandoning diagnosis, treatment, death, and much more. We will talk about the first point to be addressed, which are public policies. And as we know, they're very important so that we can foster the policies, the laws, so that we can have the coverage of childhood cancer care for our children, our adolescents, so that it can bring investment and protect a specific budget for childhood cancer, and that over time can improve the health care for these children. As we just mentioned, there were increases. When we look back, there was an increase. Nearly half of those countries from 2017 to now, these are 13 countries that already have a program in their country, a policy, a legislation, and some examples to be mentioned. For instance, the major work that is being made with health policies approved within childhood cancer in the Dominican Republic, Chile, Panama, and legislations are being passed and being implemented in countries like Peru, Argentina, Brazil, Colombia, and also countries that definitely are taking steps forward in terms of an action plan of proposals to work with childhood cancer, as Bolivia, Honduras, Ecuador, Venezuela, Colombia, Costa Rica, Haiti, Mexico, and Suriname. So this is an amazing work to foster all these activities, mainly to be feasible and sustainable over time. And in terms of the indicators, and here showing the map in 3 colors where we have yellow, green, and red, and it refers to the projects about Cure All Americas. You can see in the last few years how it has expanded.
This is due to the hard work of all of you, all the teams, and Ministry of Health, and also scientific community that are what we call as being the active projects. In yellow, we would like it to be work done by all sectors, because it's exactly the public policies and which are the health indicators that we want to show. And we want to reduce the level of abandoning the treatment, and we want to strengthen the work of all the teams working together who are giving priority to the treatment of childhood cancer. There are 18 countries that are part of this network. So there are 28 national projects and 3 regional projects, including the medication project. And it would be very important to have a survival of childhood cancer project as well. And I want to show you here that we have a special emphasis, and these projects are categorized according to these Center of Excellence. And now I will give the floor to Patricia. Hi, thank you very much, Liliana, and all of you who are here. I would like to talk about the resources that we have developed for some of the challenges which are specific to our region. Here we have over 31 active projects. As you saw their location in the previous slide, over 100,000 health professionals which get special training for childhood cancer done by the AHO. And on the keyhole code, you can see the cure-all and the resources and this initiative. And you have to see that we have 17 scientific publications and abstracts which help us to discriminate this initiative and our advances.
Como Alinas les mencionó, tuvimos el número de países que cuentan con un plan que incluye.
We have number of countries where there has a policy or law which includes childhood cancer. And these changes are also seen in the countries that have a special standard for early diagnosis of childhood cancer, and also strategies to avoid abandoning the treatment. We talked about the countries that are implementing the registry of pediatric cancer. It went from 11 to 15 countries in 2023, and we have more precise data for this specific area. We also carried out a study, and all the participants helped us to verify the barriers and facilitators according to the region. And we know that there's a difference among the different countries, but this gives us an idea of which are the barriers and what we can do to help them. We have 17 barriers and 14 facilitators, and we divide them into national context, technical assistance, and also the organizations and stakeholders which are involved. I just want to mention some important points, because it's not only the budget that's important to implement the initiatives, but also you need a coordinator that can centralize all the actions. That's very important for the success of these initiatives. And it's very important to have space to share the different experience among the countries. We communicate with each other, and as I said, that's one of the points that drew my attention, and it was my favorite facilitator. I would ask you to read this paper so that you can identify the barriers and facilitators. I would like to thank the opportunity of being here with you today and everyone else who is here. I thank you Thank you, Patricia. That was a good summary of everything and the barriers and facilitators. It was a great success. We hope to have a complete map with the analysis of the barriers and facilitators and also all the advances available, especially in terms of countries. Which are the barriers? How can we improve the service? So that's the added value. And it's important to include these changes in the systems and services. And in this publication, we have four different experiences, 4 countries, Peru, Panama, El Salvador, and Chile, which show how they have implemented the initiative. And today we're going to hear from the main authors about their experience and also the main challenges and achievements when they implemented the global initiative for childhood cancer from the WHO. We will start with a pediatric oncologist from Peru with Neo Essie Maredini. Thank you very much. So welcome from Peru. I would like to show our achievements, which are very important for us. And it's the opportunity to work here in Peru. We establish a commitment with the Ministry of Health with 4 pillars, with the facilitators, the actions. And as part of this project, we have the law for childhood cancer since 2015, and it grants benefits to the families of children with cancer, and that allows us to have a national registration of childhood cancer. And together with St. Jude's, we can observe the children, and there's a public access, and that way we can better supervise these patients. And according to different strategies and policies, such as having hospital committees, we can monitor and the follow-up through an app called Impact. We try to reduce the rate of abandoning the treatment from 18 to 8.5%. And that way we can implement quality tools such as the assessment scale, and we try to reduce the mortality of patients who are hospitalized in 30%. Next slide, please. Next slide. So here you can see how we were able to reduce the hospitalized patients, and through education to parents, we have reduced the time of administration of antibiotics. And in terms of education, we were able to have an important education with the public health school. And that way we can reduce the early cases of childhood cancer. And they have additional support of the Andean Health Center. Within all the challenges, we can say that childhood cancer in Peru is an enormous burden of the disease. It's the 4th cause of death of children under the age of 14 years. And the late diagnosis that affects the survival rate of these children in the country. And based on our experience, we believe that we need joint efforts which are done collectively so that we can have better results according to this initiative. Another challenge are the resources and this self-assessment tool of the services, and which are the profiles that St. Jude's offers. And then we see the need to increase the number of beds and also human resources. And we have obtained this with the support of NGOs during the pandemic. And that helped us a lot. And finally, the third point is the challenge of the COVID-19 pandemic. In June 2019, and with the pandemic, the early diagnosis was very complicated. However, we were able to develop telemedicine in a very important manner. Thank you for your attention, and I hope you can all read our papers. Congratulations. Peru was a pioneering country. Congratulations for these achievements. And there was an enormous impact in this short period of time. So congratulations once again. We will go to the next country, which is Panama. Dr. Karina Quintero from the Hospital del Niño, and she will talk about the achievements obtained in Panama. Hello, I thank you for the invitation and to be part of this seminar and also part of this supplement. In fact, Panama, as you said, we have many challenges, but we also advanced a lot thanks to this global initiative for childhood cancer. And since 2018, when we established the Pediatric Cancer Committee, and together with all the players and foundation and children here in Panama, in 2019, we started a review of the National Cancer Plan. And afterwards, we included a chapter which was dedicated especially to childhood cancer. And we were able to mirror these objectives. And we wanted to consider these during the period of 2019 to 2023. That would be the period of validity of this plan. And we would then start working on those principles at the beginning of the plan. And in 2021, we developed the diagnosis guide and also educating cancer. And we were able to help 1,000 people in primary healthcare, and they were trained when they suspected that they had childhood cancer in the family. And that way we can refer this patient. So in 2022, we had a workshop where we had 6 commissions. We had a commission on nursing, palliative care, early diagnosis, and also health services. And all this following the main objectives, which were early diagnosis, universal laws, and the registry as well. And at this workshop, we used the tools, and they helped us to establish the objectives which we consider as being the primary objectives. And in this year, we can see the treatment guides. And at the moment, we are doing a virtual course, and that's so that we can achieve more primary healthcare providers and give them this course for initial or early onset of the disease. So this impact was seen in this article. It's very important to hear what the patients had to say, that we're able to be diagnosed in very early stages of the disease. And there was a difference between 2020 and 2022 was of about 30%. But in fact, these small changes are those that for us motivate us and really make a difference. Such as you can see this picture of Isabella. She was the first cancer case, and she was diagnosed very early on, and that was very special. And we will continue working to help children that can be diagnosed as early as possible. And that way we can continue with this service. Thank you very much. Thank you, Dr. Karina Quintero. Thank you very much on focusing on early detection. And we know that in the community, that's very important to increase the care of these children. So we will continue with El Salvador now, with Dr. Andrea, who directs this project in Salvador. Good morning. It's a pleasure to be here with you all. I will be presenting what we as a country had and the success we had to implement all the elements of the approach of childhood cancer treatment. We started by doing a situational diagnosis, and that way we can identify our starting point in relation to the capabilities that we had in these countries, and also establishing which were the main elements that we could use so that we could fulfill the pillars of that tool. So first of all, we established this diagnosis that really helped us to understand all the issues that we have with the different entities and establish our cancer control plan for children and adolescents, because we had this cancer law in our country. With regards to the excellence centers, we identified that if there's a detection, our excellence center, which is the National Child Hospital, and they use this hospital as a reference center, and the multidisciplinary team, if they identify a factor or a symptom, and there we have the oncology department at this hospital, and it is held by this association. This is a coordinated work which is done, and we also have the support of that the multidisciplinary team can work in terms of protection and also prevention, because in our country that is very important to have this early diagnosis of the disease, because the prevention component is very important.
So today we have a vaccine for 9 to 10-year-old children, and we know that's an important factor that will give us support to this type of cancer and also to other types for children. It is important to mention as well that when it comes to such evaluation and monitoring, we have also attached our registries where we know that for Benjamin Bloom Hospital, they already had the registry, and we were able to do that, and that way we could standardize it and have this in our third level hospital for the health ministry with the registry of cancer among the population. And that way, the goal is that all of these cases of children and adolescents that are identified, we can have their registration and we can surveil them. That way, we can have a better coverage for diagnostics and also have a better registry and identification with diagnosis and a suitable care. So it's very important to mention all the educational process that we have with the healthcare professionals. And today we are fostering the adherence strategy for children's care. And we will have a workshop of diagnosis with the main childhood references to encourage and to develop their skills together with the cases to be discussed. And that way we can have them as references once we do need and improve the center of excellence. All of this based on our legislation together with a plan of integrated care with teenagers and adolescents, which is what we have to bring orientation to establish the path to be taken for a better approach of cancer during childhood and adolescent years. And this is all worked together with the National Alliance for Prevention and Control of Cancer, where the foundation can help me to live, ajude-me a viver, is very important to this partnership as all the other ones. One of the challenges we have is the strengthening of the human capacity as a main element in the excellence centers. So in general, that's what we've been doing, trying to address all elements of cure all, and these are all the different progress points we've done. Thank you, Dr. Shikhan. Thank you very much for such broad scope and efforts with the excellence centers, which was important to improve childhood cancer care. Now we will go to Chile. Dr. Julia Palma, head of the National Cancer Program, so she can show the impact in Chile. Dr. Palma, thank you very much. First, I'd like to thank the opportunity to talk about the challenges and changes we had in Chile and the opportunities that were given through this work in a collaborative manner. We were able to work in the National Program for Childhood Cancer, PINDA, and we've had it for over 20 years, and with the profile metrics led by Dr. Femsen. And we saw through a 360 analysis the centers of our country, and that allowed us to see and analyze the gaps and opportunities we had based on the analysis of profile. And that way we were able to see what we had to improve. We had to improve points in terms of nursing, in terms of our team, our primary care team, for the adolescents to have access also to many studies and to be able to have a psychosocial program improved, and to see how we could also improve and extend our care to patients up to 18 years old. So there are many gaps that we want to work with, and we also want to check and analyze. And we see with St. Jude and the support of Profile and their team, we were able to go for rounds in Chile working with health centers and hospitals during the pandemic to improve the results that we had at a great quality in our country. You know that in Chile, 85% of patients go through the public health system, where 79% 0.5% of cure of cancer in adolescents, and that's a possibility to see it at a 360-degree view, show that much could be improved. And that's where we had the possibility of working in a agreement in institutional cooperation where the Ministry of Health signed an agreement with the St. Jude's Hospital, and we became then a member of the alliance. And not only in terms of institution, but also from a ministry standpoint. And that made us have a dream to work with this progressive structure of PAHO. And this allowed us to see where we were at in Chile and to propose where we would like to head to and what we would be able to get with the structure of work of WHO and the progressive framework and what the action plan would be in Chile. We had a national plan for adults that increased childhood and adolescence. In a very invisible paragraph, we had a people cancer legislation together with PAHO and St. Jude. We were able to propose and draft a program for adolescents. And up to this moment, we have a group drafting on the program. We work together with St. Jude, with their support, one that works in Latin America to use the result analysis methodology and to propose how we would like the action plan to be based on the cure-all pillars. And based on this perspective, we worked on 4 pillars so that later on we could bring our objectives and propose a national programs for adolescents that is included in all these transversal pillars for funding, and also to be able to have in Chile a national plan of cancer that will be released but already has specific objectives. I would say that the big challenge in Chile is to have a program ready to be released and is already being legally reviewed by the ministry so that we can have finally a national childhood adolescent program for 2023 to 2028. And there's a big challenge of putting this into action, all that we have planned so that we can act in a way that can be targeted based on everything that we have analyzed to improve quality of life and improve the health of these patients. Thank you very much, Dr. Palma. It is a great analysis to get to this point of having a national plan, which is amazing for the country. You can count on our support from PAHO, St. Jude, and the whole community in the region so that we can have the plan up and running for children and adolescents. And not only do countries benefit from this global initiative when it comes to childhood cancer, but in Americas, we have integration mechanism in health. We have 3 subregions, Central America, South America, and the Caribbean. In the next panel, we will have the authors that wrote articles about sub-regional efforts to benefit countries in the sub-region. Each will talk about how countries are contributing within their sub-region to be improved in terms of childhood cancer care and their co-joint actions and practices be implemented to have a better impact. Let's start with Central America with Dr. Kachuska Alvallero from PAHO Central America. Thank you very much, Silvana, for introducing me. Good morning, everyone. It is a great pleasure to be here and share this day with you, where we have the journal edition rolled out. As you said, I am in charge of the program for the Central American region, and the Dominican Republic. This was a collaborative work to be able to have a catalyst of the global initiative for the childhood cancer care for our subregion. And we also have Dr. American, who is also the one responsible for the Central American region, and Dr. Pontes, who is an international consultant for pediatric cancer for the World Health Organization in PAHO. And I'm talking about the subregion program, which is one specifically for our region, has a strategic role and is an articulator among technical teams in the region and the World Health Organizations and the central action, so we can have a technical cooperation that can bring an outlook to our 8 countries in our regions: Belize, Costa Rica, El Salvador, Guatemala, Honduras, Nicaragua, Panama, and the Dominican Republic. Our main partners who we cooperate with is through the integrated system for the Central American region. And we have the CAMC Comisca to work in this region. So we have a specific report for this. And as a team, we are part of, we have some delegates also from PAHO and from our center. And we couldn't take on all these initiatives if it weren't for St. Jude Children's Research Hospital. And we also support the national panels, national programs for pediatric cancers, and to improve survival rates and to improve quality of service for our children and adolescents with cancer, to improve access and the quality of health services, including palliative care. Thank you very much for showing the slide, and I'll explain how each work, their octagonals were here. I wanted to show the 8 countries of the region. Through a collaborative work, we were able to take decisive steps that were effective. And here we have on these boxes on the slides, one shows the formulation of these national plans that have been drafted by the Central American countries, the ones that I had referred to with the national plans. And we also had the rollout of campaigns of awareness and promotion, where we had the creation also of the educational material for children and families, which is very appealing, with a playful approach and favors children and families to understand the disease and the step that the children and adolescents will have to go through. We also develop platforms of dialogues between peers to share best practices and successful experiences. Every 2 weeks, we gather for different topics, of which the subregion, as we call at PAHO, can interact and get to know the best practices and also get to know what was done and the activities that had some impact, so that we can benefit from this sharing from each other. At this moment, we are also developing standards and practices for clinical guides in our region. It has already been defined how we will have the great methodology, which is the one recommended by the World Health Organization and PAHO. And this report describes the collaborative work that definitely was a teamwork, very much important, where everybody was very close, where we have PAHO, CAMC, and Comisca, and St. Jude Hospital. And that allowed us to bring on all the research, advances, and practices that we're sharing. We hope that the population of children and adolescents of Central America that were affected by this disease can have benefits from the work that we are applying in our subregion in Central America. Thank you very much. Thank you very much, Dr. Kachuska. Great work. and to have the campaign and material and clinical guides for all countries in Central America. And now I'd like to pass to the Andean countries, and we have here Dr. Maria del Carme, I shall say, who will be talking about the initiatives in children's cancer. Thank you very much for the opportunity to be talking here with you from our region, which is a reference in the Indian reference of integration. So we can say that we are fully convinced that the rights of girls and boys and adolescents are very important, and to definitely work for them is a priority for our organization in the Indian region of healthcare. And we know that cancer is one of the main reasons for death among children and adolescents from 0 to 18 years old. This is Peru, Chile, Colombia, Venezuela. And we know that the cancer in this region is very similar to other countries in Latin America, where the mortality rate in this region is of 2 deaths by 6,000, which is very high compared to the other region, which is 4.8 deaths by 100,000. In high-income countries, where we're talking about 85% survival rate, and of low regions, we're talking about significantly lower ones, and they are from 10 to 60%. On the other hand, there were severe infections on nearly 20% of children with cancer that had COVID compared to the other children, and 4% of patients passed away because of COVID compared to the mortality of 0.41 and 0.7% of pediatric patients overall. So if we consider the factors that make the disease more severe, we know that late diagnosis, the toxicity related to the treatment and no adherence to the treatment that make you have higher rate of death. And the impact of the pandemic caused a high morbidity, and it made very valuable a humane agenda of health ministries from different institutions as World Health Organization, PAHO, and sub-regional works and St. Jude's Hospital, and also to be able to face the problems of the pandemic in the population. I shall say that St. Jude came to Peru when I was the General Director of Strategic Interventions many years ago, and that's when all this work started, and now it is definitely wonderful. And this did speed up the implementation of all the global initiatives and regional ones, as the global initiative uh, against childhood cancer. And Oras Konu is now one that has been taken by the Chile, Colombia, Bolivia, and Ecuador, Peru, Venezuelan agencies to have this as a priority, and cancer as a public policy issue. So what are the results? A specific diagnosis was drafted from 2015 to 2020, another the situational diagnosis for baseline of childhood cancer from 2015 to 2021, and a respective guide with the main strategic lines, and the REMSA resolution 4543 approves Indian policy for the healthcare control of childhood cancer. Here's the photo of all of those who took part, and it's responsible to take on these plans. And obviously, the extraordinary resolution of the 36th REMSA 04 has here the Andean Committee for Cancer Control, the drafting in monitoring implementation of the guides and to promote mechanisms in the sub-region for a better surveillance and evaluation of all the international commitments and the national ones as well for the improvement of health care of cancer among children and adolescents.
It was published on the 15th of August of this year. And we also had webinars to improve childhood cancer in the Americas and the fight against cancer. And together with OPAHO, our main strategic partner in the level of cooperation in health, as from June this year, we worked in the project of early detection of childhood cancer in the Andean region with the active participation of the 6 Andean countries. And we had the following objectives: strengthen the competence of the health providers through training methodology of PAHO based on early detection, primary detection, and recognizing a early detection in regional areas. And this is being developed and strategies to regulate the activities, and also the publication of a report on cancer that was written by the following authors: Maricela Luiz, Colis Chaves, Patricia Gallardo, Liliana Vasquez, and Hernan Sepúlveda. At the moment, we are working jointly among institutions to have a prevention plan and cancer control for the period of 2024-2030, and also preparing a draft to prevent childhood cancer with documents and guidelines, and we hope to finish by the end of this year. The Orascono, which is the Andean Health Organization, they believe that children and adolescents come in first place. We should use the evidence as the basis of our work, as well as establishing cooperation mechanisms to develop sub-regional strategies to improve the early detection of cancer. And good quality treatment for cancer and childhood cancer. Bolivia, Chile, Ecuador, Peru, Venezuela, together we are stronger, and together we will go further. Thank you very much. Thank you, Doctor, for this initiative, for your leadership with the Andean countries and your work there, and also the communication campaign. So this work that we will be having next week, we will bring together all the ministries, and we will be there together to continue talking about childhood cancer and other non-communicable disease. Thank you very much for your support.
And we have with us today Dr. Michelle Reese-Mills, who's a pediatric oncologist at University Hospital of the West Indies and leading the Caribbean Sick Kids Initiative, or very involved in the Caribbean Sick Kids Initiative, to talk about the Caribbean and how they've united to improve childhood cancer. It's wonderful to see you, Dr. Reese-Williams. Over to you.
Oh, thank you so much. It's certainly my pleasure to be here on behalf of the Sick Kids Caribbean group. I am just one player in the cog, but I will talk a little bit about what we've been doing. If I had one word to describe the impact of the Sick Kids Caribbean initiative, then that would be transformative. The initiative has definitely positively impacted the outcomes of children in the region. I just wanted to give a little bit in terms of background. So this is a collaborative effort between the physicians at the Hospital for Sick Children in Toronto, Canada, and 6 English-speaking countries in the Caribbean: Bahamas, Barbados, Jamaica, Trinidad and Tobago, St. Lucia, and St. Vincent. And the primary aim has been to improve the outcomes and the quality of life of these children in the region. Prior to this association, pediatric hematology and oncology, cancer care has not gotten much attention in the region. If you look at the outcome of the most treatable cancer, which is acute lymphoblastic leukemia, we know that the 5-year survival rate in North America is around 90%, but this falls to around 60% in the partner countries that have been mentioned. And so we can see that there's a lot of work that needs to be done to close this gap. So this partnership or twinning association officially started in 2013, initially informal, and then became formalized with specific goals or initiatives. And as outlined on my infographic, so there are key areas that we're focused on. So one, importantly, increasing the capacity in the region. And so between 2012 to now, there have been 5 pediatric hematologists, oncologists who have been trained at the Sick Kids Hospital, all of whom have returned to the region and are improving care within their respective countries. We also have 1 fellow that is being trained now, and the aim is to have a fellow trained every few years, so that gradually we will increase the capacity in the region to where it is actually needed. There has been a focus as well on nursing education. So 41 nurses have been trained over the last few years. We do a lot of case consultations where we've had expert advice provided in over 600 case consultations, where there may be difficulty in terms of diagnosis in the different countries. Then we're also assisted by sick kids with, say, flow cytometry, immunohistochemistry, so that we can accurately diagnose those cases. The development of local oncology databases also, again, is something that's focused on. So we'll know the kids who are doing well, those that may have abandoned mortality, who may have progressive disease, and so we can better impact income. Not to forget sickle cell disease, there's been a focus on newborn screening, and we've actually done given support for over 800,000 cases in Jamaica and St. Lucia. Advocacy, very key, and stakeholder engagement is also a big focus, both locally and internationally, so that we can keep the initiative going. The initiative is actually now in a phase of sustainability. So the emphasis is now on not just being led by sick kids, but how can the partner countries actually be more involved and actually take the lead in continuing this initiative. This will be supported by still the Sick Kids Foundation, which has generously, there's a foundation that has been generously developed in honor of our leader, I could say, Dr. Victor Blanchette. So this collaboration has strengthened the ties in the region over the years. And I think if we ask ourselves, are children with cancer and other blood disorders in the region better off than they were 10 years ago? I would say the answer is undoubtedly yes. So we continue to prioritize and progress in the right direction, and to keep our association going from strength to strength. Thank you so much.
Excellent. Thank you. And congratulations, Dr. Reese-Mills, to you and the entire Caribbean community and the Sick Kids team who've been working so arduously for many years to improve childhood cancer care, and especially for the part of reinforcing health human resources, because we know such specialized care requires specialized training. And it's wonderful to hear that they're returning to the Caribbean after being trained at Sick Kids. So thank you.
All right.
So we're going to continue. I know we're running a little bit late, but we'll try to compress all of this. We've got so many wonderful stories and articles to talk about. And one of the really exciting pieces of the work in Curl Americas has been around the advocacy and awareness raising, which we know is really critical to create change. And the team has been very innovative in using storytelling strategies to promote national childhood cancer policies. So in this next panel, we have 3 leaders in the storytelling strategy who will talk a little bit about the experience. We have Dr. Suad Fuentes Alabi, who is our very own PAHO childhood cancer consultant working on Cure All Americas in the region with PAHO. And then we have Dr. Irini Albanti, who is the Executive Director of Harvard Humanitarian Initiative, and Megan Shea, who's the Director, Producer, and Co-founder of Persistent Productions Film. So we're going to start with Megan, and note that not every day those of us in the public health community can engage with filmmakers. So we're really thrilled to have you share your experience and expertise with all of us in the childhood cancer community around using the storytelling through mediums like film. And can you reflect a little bit on how this has helped to bridge the gap between healthcare providers' knowledge, the general public's knowledge, when it comes to understanding the challenges and needs for children with cancer, and how storytelling can really help improve childhood cancer care? Megan?
Thank you so much, Silvana, and thank you so much for having me to the meeting and including me as a filmmaker. So I'm looking forward to sharing how storytelling can be one of the tools that can help bridge and ignite the conversation between healthcare professionals and the general public. And I wanted to use our film, How I Live, as an example of this. How I Live, and you'll see the poster in the top right of the slide, is a documentary film that follows the journey of 4 children with cancer, their families, and their healthcare providers in El Salvador, Guatemala, Egypt, Myanmar, and Ghana. There is a feature film version of How I Live at 90 minutes, and then there are shorter teaching versions at 22 minutes and 13 minutes that we've used in a variety of ways to share information about the survival gap in childhood cancer and the Global Initiative for Childhood Cancer. What you will see here depicted on this slide is a visualization of our impact distribution strategy. And so what does that mean? These are the targeted areas that we have looked at to screen the film to include both public health and policy and also general audiences. So what you'll see are these 3 target areas: meetings and conferences, and that includes screenings at PSYOP, regional GICC meetings, a screening and presentation at the Peru National Cancer Congress, and a PAHO workshop, Como Yo Vivo, which we'll hear more about. It also includes film festivals, general audiences, arts audiences, and we're proud to be part of the online public library collection at Canopy, so that gives us streaming access as well. And then our educational distribution includes both in-person screenings, like our recent screening and panel at Harvard Medical School, and also a number of remote and digital teaching sessions and screenings with universities such as George Washington University, Duke University in Singapore, the University of Arizona Medical School, and a number of others. So these are all of the ways that we have, tried to bridge that gap, both in terms of audiences and target distribution, but also really to show that film can be one of the tools when looking at policy change and impact and storytelling. And I look forward to handing off the microphone to my colleague, Irini Albanti, who'll share a little bit more about our strategy and implementation.
Thank you, Megan, and thank you, Silvana, for the warm introduction. Hola a todos y todas. Es un honor estar aquí con ustedes. As my colleague Megan said, as mentioned, I am honored to have been working with her as one of the 2 film producers of the How I Live documentary, along with Michael Rogers from Persistent Productions since 2014. I'll give you some context before I explain the graphs on this slide, and you can read more in our recent publication in the PAHO Journal of Public Health. So when we started brainstorming on how we can use storytelling to impact change in global childhood cancer, we wanted to share the reality and stories of patients, families, and healthcare providers in a respectful, authentic, and impactful way. And I know that we all can read the latest report about cancer outcomes in The Lancet and review the latest article about a promising clinical trial, which is good. But the beauty of the How I Live documentary is that it shows the striking and unequal survival rates in global childhood cancer in a compassionate and engaging way right from the homes of the patients. It invites us to reflect on these health and social inequities in a complementary way to scientific publications and advocacy efforts. So in addition to being a compelling piece of art about global pediatric oncology, the How I Live film shows what a powerful tool storytelling can be. How we in an academic and medical setting, we can use videos to raise awareness, advocate, educate, fundraise, and create social impact and change in public health, and the value of collaboration with other disciplines outside medicine and science to decrease inequities in childhood cancer. Films can serve as influential catalysts for social impact and innovation and inspire action for change. So as you can see on the slide, our team developed our own theory of change, and our work focused at the intersection of three areas of expertise: storytelling, the film, public health, using strategies and frameworks from global health strategy, health promotion, health communication, and childhood cancer, with the ultimate goal to impact change. From our initial stages, we were intentional with the design and implementation of our strategy, starting from documenting the lived experiences in order to reach a wider audience beyond the medical, clinical, and engage different stakeholders. The next goal was to inspire call to action, mobilize, and then create impact so that we can decrease the global inequities. In all our efforts, as you can see in the bottom, we were focusing on 5 impact areas. 1, educate, as Megan just mentioned, educate the general public, but also healthcare workers, from medical students to nurses, social workers, pediatricians. We developed an educational curriculum using the United Nations Sustainable Development Goals, and we have been giving talks, grand rounds, lectures at hospitals and universities using the film as the main education rule. Then raise awareness about childhood cancer by organizing events at conferences, symposia, or events like the one we are here today. For example, we screen the film and use a clip during various SIOP and World Cancer Congress, including to complement the launch of the first Lancet Convention on Childhood Cancer in Japan. Also, change policy. For example, in Peru, as Silvana mentioned, Peru was a pioneer with the leadership of Dr. Liliana Vázquez. It was possible to use the film change local health policy by introducing new national cancer control plan and creating local health system change, including increasing visibility about the cause and awareness. The 4th impact area is advocate, to increase advocacy at global level. For example, we use the film at the PAHO workshop to engage key stakeholders from pediatricians to policymakers, and the Global Initiative for Childhood Cancer, as we are all here today, has used the film and clips to advocate for change and support. And last, fundraise. The film has been used as a tool for fundraising, and Dr. Fuentes Alabi can give you more information. They use the film when raising support from the hospital, the foundation, to ignite local fundraising efforts by bringing in the patient voice and making the emotional connection with donors. So I would like to thank you for your attention. Megan and I are welcome are happy to get your questions or emails whenever you have a chance. Thank you.
Excellent. Thank you to both. And if you haven't seen How I Live, we encourage you to please see it. It's a very moving and emotional film, and that's why they've been able to have such an incredible impact in all these areas. And I especially love the focus on education and reaching the university students and educating, because I do think we need to create that next generation of people who are going to help work on reducing the inequities in access to care for childhood cancer. So thank you to all. And now we have Dr. Alabi, Dr. Fuentes Alabi, who's going to talk about how we've used at PAHO this storytelling workshop and the film to have impact. Over to you, Swet.
Thank you, Silvana, and thank you, Megan and Irene, for all the support with the film to use the storytelling to engage stakeholders. And thank you for posing such a critical question, Silvana. Reflecting upon the outcomes of our workshop and the prioritization matrix, there are several immediate actionable steps that stakeholders can take. As a first step, the National Pediatric Commission must establish priority collaborative portfolios that allows teams and in further narrowing areas of collaboration into specific projects that can be achieved in the near and long term. Additionally, teams will identify resources needed to complete prioritized projects. To mention one, for instance, resources allocation, prioritize the allocation of resources, both financial and human resources, to the highest impact activities identified in the project prioritized in the matrix. Collaboration between other organisms that are also involved in providing care for childhood cancer, like engaging in multi-sectoral partnerships that mean not just government and health agencies, but also non-governmental organisms, private sectors, and communities. Awareness campaigns, begin at the grassroots level awareness campaigns, early detection, for instance, is a key to improve survival rates. And during the workshop, one of the projects and activities that were prioritized during the engage with the GICC, the storytelling of how I live, was early detection. So following to that, a lot of the countries in the Central America region and also Dominican Republic have been working to educate communities about the early signs of childhood cancer and the importance of timely medical interventions can save countless lives. Now, the next step also, we have to start data collection and monitoring of all the implementation, the robust data collection mechanisms, by monitoring and evaluating these interventions in real time, and continue with this information, providing policy advocacy to support the early detection or the improved treatment or care, to continue strengthening the health systems to provide care to children and adolescents with cancer. In conclusion, while the prioritization matrix gives a roadmap, the journey towards a strengthening health system for pediatric cancer care requires consistent effort, collaboration, and the collective will of all the stakeholders. Thank you.
Excellent. Thank you, Dr. Fuentes Alabi, for showing us how the film and storytelling can really help improve system strengthening and using these sort of prioritization matrices and very standardized approaches to system strengthening. So thank you to all our panelists, Dr. Albanti, Megan, Dr. Fuentes Alabi, for highlighting storytelling. And again, look at the film, How I Live. It's very powerful and moving. Thank you. So I know we're running a little bit over time, and I thank everybody for their patience, but we have such great work and so much passion in expressing all this great work. So we have one other panel that we would like to showcase, and it is about the collaborative work that has been going on through the Global Initiative on Childhood Cancer. I'm going to switch to Spanish because I think the next panel is in Spanish. So en Cural América se ha creado varios grupos de trabajo.
So we have many work groups for these collaborative work to be implemented and that we can bring to the region. So we will discuss all the advances in terms of all this collaboration. So in terms of all the psychosocial work, the palliative care, and the influence of civil society with cancer. And in this panel, we have Black women with pediatric cancer that are leading the work groups for the supplement to this journal we started at the Catholic University in Peru. And that we will have that talked about the psychological work done. Thank you, everyone. Thank you for this opportunity to share our experience with a psychosocial work. And in this article, we talked about the process that was developed through a process that had the initiative as a main point and with references as pillars. And it's important to highlight that we must verify that. And I would like to thank Marcelo for all these works and La Roche and all the professionals. And this was an experience that came from Peru. and it was taken to Latin America and the Caribbean region so we can keep developing it. And to answer a bit about the question of this panel, it's important to understand what are the main advances, and I should show some central points to you. The most relevant was the broad participation of professionals in different institutions. First, we had Peru with the analysis of the situation and with the psychosocial care in the region, the consolidation of this project with a committee and multidisciplinary groups so that we could extend this to the region with a psychosocial committee regionally with experts. And this allows more than 50% with many professionals taking part, or better, 50 professionals taking part in these groups, sharing experience, drafting content. So thanks to all of this, we were able to get our core goal, which is what I mentioned about the improvement of the psychosocial care. And this is based on evidence at an international level, all aligned with that and the basic care to be able to bring this in and to use the available resources in the region. And we also developed special psychosocial care. And as every child with cancer and their children, they can have access to it. And here we can see the competences to be developed and what their team need to pay attention to. And the focus that is very relevant was developing transversal pillars to be considered throughout the special care, gender, culture, right? So this proposal brings to us a framework to work with and also the needs to have goals set and to that way prioritize the resources that are available in the region. So also thanks to the development of this proposal and the participation of all professionals, that we have this third aspect, which is the strengthening of professionals and also creating the specific material for healthcare professionals. And we have all of this where we have at the PAHO website, all this material also in English, and we have specific spaces. We also have education for a professional with a psychosocial module for the public health education in Peru with the pediatric cancer program. And also when it comes to PAHO for the education to strengthening the capabilities of healthcare professionals. So once you have all of these points, we should mention some challenges that we had, which was to develop a strategic plan in the region to be able to bring these standards. And we think about 2-3 countries that can be one to develop a guide to be reviewed so we can later use in other institutions, other countries, and have it implemented as well. And I should highlight that this will be possible thanks to the intersectoral support and development of policies for access, quality, and psychosocial program throughout our region. And I shall invite you all to get informed about this project, read the article, and thank you for all that we have reached. And I'm very excited with all our efforts in this initiative. Thank you, Dr. Trigoso. And now let's be able to go to the website to check the material. And now we will go to the next one. Okay, we have here now Dr. Jimena Garcia, and she will be talking about her material. She's from St. Jude's Children's Research Hospital. I'll be talking a bit about the work that we did in collaboration with the Pan American agencies and showing that palliative care is brought as a main pillar for cancer patients and also for other catastrophic diseases and healthcare organization that is fostering such program before 2014. However, that is not always taken forward, and all the barriers in palliative care are many. So one point is the lack of education from healthcare professionals and also in terms of the community as a whole. For this specific work, the main role is of parents that have an important role in the care to improve the health points, and we need to make the best decisions to be able to take the best care of their children. That's why we have developed this project that we did in collaboration with the Tahoe team and our St. Jude's team, and with a group of regional experts from Latin America and the Caribbean. And that way we were able to identify that one of the main priorities for parents' education with children with cancer was to address and understand the misleading information and understand how parents can help their children to reach quality of life and not have that much suffering. This group of experts and the collaboration that is wonderful that we developed was able to bring the result of having 8 modules, and here they address different topics of palliative care in terms of treating pain, handling pain, improving quality of life, and what you can do at home with patients. And this content was validated by this group of experts. And finally, we were able to have these 8 modules set, and now they're translated in many languages. And during the first 15 months after it was published, they had over 2,825 times. It was downloaded 2,800 times. So this shows that this type of project that we focus on, where we focus on the main caregivers with their impact, we can improve the quality of life of children and reducing and relieving their suffering. So it's important. This collaboration was very important for us, and we hope that these modules can reach more people, more parents, and we invite you to scan the QR code and you will find the article and you can have free access to the modules. Thank you very much. Great, wonderful, Dr. Garcia Quintero. Now let's get to the next one, Dr. Ana Mendieta. She is a specialist in ER or emergency care from the Peru Hospital, Rebagliati Martins. Hello, good afternoon. I'd like to thank the whole team that organized this activity in a way that is very positive and very important. And in our emergency pediatric care where I work, and this is the hospital I refer to in Lima, Peru. It is located there, and we have high complexity patients coming to us. It's not exclusive to children, but we have pediatric care, pediatric emergency care, and we have all the patients with high complexity. And within this vulnerable group, children come, and the ones that are undergoing some treatment of some hematologic problems. So this is a continuous program for improvement, and it comes as a multi-model strategy to improve the medical treatment of cancer care for the children, one that was developed in the pediatric emergency care service. And the idea was to break down barriers, bring changes of culture for the healthcare professionals, and trying to really improve the coordination in these countries. So we had as a scenario with a pediatric patient that would have to wait to get the antibiotic treatment when they had high temperature. And we got studies found in 2007, 14, 2020, and the waiting time for the onset of the treating with antimicrobial was something that we would recommend according to literature. So we went through an important analysis with all the specific treatments to understand exactly what were the points that could work. And we used specifically tools of quality to really improve these scenarios, and obviously the most accessible ones. With the strategic areas, with health ministries, and the hospital was able to have an educational system for the healthcare professionals, with the idea of essentially having a seamless criteria of the patients with neutropenia to coordinate the process of care with priority, and also using algorithms to have a surveillance of these patients. We had to call our lab professionals, pharmacy professionals, so there could be a good flow of these patients following an ideal time period. And what was the impact through this educational tool that was developed in support with many experts in infectology and other areas? It was a virtual platforms that some topics were developed to empower and train all these people. So the emergency care, nurses, residents, all of those that worked in our services and had an important participation with these patients. So all that we collected in terms of data, we reduced the time for impact. So if before we had a longer time uh, in the onset, right from emergency all the way to the special unit, we had this tool to be able to check that this time period could be reduced in to 2 hours, 66% in 1 hour. So we have here a level of awareness and perception that improved greatly of what we had before. So this team is one for continuous improvement, and that developed this with all the proposals so that we could have that continuous improvement of patients with cancers. And here we have a positive impact in all the systems. What's most important is to say that we were able to have the pediatrics patients, when they had these complications, get more opportunity to be able then to keep having their care given. And this became a project of continuous improvement that believes in continuing to release into hospitals that work with cancer patients where there's a great diversity, where we need to get over some cultural barriers, social barriers, and the service health systems must improve greatly. Thank you very much. Thank you. That was definitely great work, amazing impact. And now the last presentation for this panel, which is Dr. Marcela Zubieta, President of Fundación Nuestro Hijos de Chile, representing here Latin America. And now she will be talking about the support of civil society. Good afternoon. She says she has a hoarse voice, but she will do her best. And the Civil Cancer International is one that brings many civil society organizations in all countries of the world. And since we realized with the different presentations here in our region, we have quite an equality when it comes to care for patients and adolescents that suffer from cancer. So within civil society, we have an association with 42 organizations from 17 countries. And here you can see on this slide, and we work in alliance with the PAHO, with the Latin American Pediatric Oncology Association, and also we have the support of St. Jude.
So every year we have a conference where we have the support of these stakeholders, and we are committed in improving the care of the children with cancer, not only making them more aware of it and giving them some psychosocial support in many cases, as we showed. And as well as giving them relevant medical care. And that way we can help children in different countries. And they're committed with a cure-all strategy and to fulfill their role in an efficient manner. And they have had several initiatives to try and improve the standards of the organizations in a more efficient manner and in such a way that it could inspire amongst them all, showing the success stories of the previous years. This program started in Latin America, and it is already been sent to Asia as well. In the past few years, this was very important to help the children with cancer. This initiative brings us hope. And that way, we hope that in the next 7 years, we can celebrate the success of this program by increasing the survival rate in all countries in Latin America, because a child says that she could die the next day. That's the role of civil society. It's an extremely important role to maintain the health of these children. So thank you very much. And it was very important to be able to publish in this journal. I would like to thank Silvana Marquez. It was an amazing support for our region. Thank you very much, Dr. Zubieta. And the role of civil society is essential in these areas. And now we have a short video which is a professional organization that supports our work in the region. So let's have the video. It's a great pleasure here to talk about the additional supplement of this journal. It's extremely important for us, the Latin American Society of Pediatric Oncology, to show the support of the first 7 years since the global initiative started, support the battle against childhood cancer. We have to bring together our efforts with all organizations all over the world to ensure that children and adolescents with cancer have access to early diagnosis and quality care. That is crucial. As a result of this joint work, we have seen enormous advances in early diagnosis and the survival rate of our patients. But we know that there is a lot still to be done. And that's we fully support the global initiative for childhood cancer of this amazing mission. Together, we can make a difference in the lives of our children and their families. Let's continue working in collaboration so that all have access to efficient treatment and quality care, regardless of where they are. Thank you very much.
Buenos días, queridos amigos y amigas de Latinoamérica. Quiero agradecer especialmente a la doctora Liliana Vázquez.
I would like to thank Dr. Liliana Vázquez for the invitation. I'm Dr. Guillermo Chantada. I'm the president of the International Pediatric Oncologist Society, and it's an enormous honor to be here representing all for the launch of this journal and this program that that PAHO develops to treat childhood cancer. CIOP is part of this program of the World Health Organization, and it has an important role. It's an honor for us to be part of this webinar, and we're always supporting the association, and together we are finalizing the mapping of all the centers and resources for childhood oncology. We have all the data for Latin America, which is available for this program. And CIOP also supports research through a program that talks about pediatric oncology. Here we are supporting this group. They do an amazing work in terms of research in this continent and expanding the spectrum and showing these results so that we can improve the survival rate of children with cancer. And also, we support the education through this pediatric association and other institutions that support our program, such as the programs where we develop 2 years where we train oncology pediatricians in the region. And we have been doing that for the past 3 years already. I'm very happy to be here with all of you. And I would like to send my regards from Montevideo. And it's an honor to work with these associations. So with this, we have come to the end of our webinar. It's amazing the work that we showed here, all the articles. It was amazing. After 2.5 hours, there are more than 500 people still following us, which shows our commitment and the desire to improve the health system, as well as the care of children and adolescents with cancer. So we will end our webinar with a few words from Dr. Carlos Galindo. Thank you, Silvana, and all of you for these amazing 2 hours where we shared all the work. I heard amazing initiatives, very focused and centered on transformation, which is what the region needs and what we need as well. Every day for years through this global initiative on childhood cancer, when it was launched before the UN Assembly, we asked for the right of cure, not the right to treatment and right to access, but what we really wanted was the right of the being cured, the right of the children of having a future to live. And that's how we started. And that's how this right to live became a technical work, which is what we want to follow. And in a few weeks' time, we will be in the UN again, celebrating the 5 years of this initiative, showing the world that we have effectively want to show the right to all these children. And we saw that we are prepared. We are ready for this challenge that we have. And we're working seriously, and we are prepared to face other challenges from Rio Grande all the way to Patagonia. These challenges that might impact the children. We are very proud, and we would like to congratulate you all for everything you have done. During the past 2 hours that we talked, I'm sure other children were diagnosed with cancer, or children that died at home or in hospitals. So we still haven't been able to achieve what we wanted. We have made some amazing advances, but during the pandemics, cancer couldn't wait. So we are very resilient, and we have to be very focused to continue this path. It's an effort that requires the best of all of us, from the governments, from health policies, from health systems, hospitals, health professionals, and the health policies of professional organizations, and patients as well, lawyers, children with cancer. It's as we say, we need a whole city to treat a child with cancer. And that's the community that we are building in the Americas, in our own communities. We have a very concrete objective, a very concrete focus in the community where we all have a very important role. We are all together with this feeling of belonging and future. So from St. Jude, from this global program we have been trying to fulfill this dream that no child should not have treatment. So from St. Jude, we're trying to make this dream come true with research, education, and working intensely. And there are over 200 institutions all over the world and 70 countries. We are trying to help so that we can improve the future of these children. Recently they said that the best way of predicting the future is by creating this future. And that's what we're doing. We are trying to create this future for our children. So I don't want to extend my presentation, but on behalf of the St. Jude, I would like to thank you all, and Paola and everybody from Latin America, Dr. Kathleen, all the team that was working in a very important way. You can be sure that we are very proud of being part of this initiative and thankful that you allowed us to be part of this path. So we will continue with you, with all our friends in the region, and we hope that we can continue to share and celebrating successes in the future and all the lives that we're going to save together. Thank you very much and have a good day. Thank you all.
Muchas gracias. Si pudiéramos tomar una foto.
Thank you. Let's try and take another photo here.
A ver, creo que son varias pantallas. Sí. A ver, la de 3. 1, 2, 3.
There are several screens that we will be taking the photo of.
Un momento todavía. ¿Qué son? A ver, ahora sí, 1, 2, 3. Listo, gracias.
Excelente.
Thank you all.
Excelente trabajo. Gracias.
Congratulations.
Chao, muchas
All
gracias.